What's up, everybody? Ryan Underwood here with Ace Aviation Services, and today we're here with an AME, Dr. Alan Kozarsky, and Dr. Kozarsky is who has given me my last few medicals, so we wanted to have an interview with him. He's taken time out of his schedule, and he's going to answer some questions that we all might have straight from the horse's mouth. So, Mr. Kozarsky, first, tell us a little bit about your background and your history.
Well, I am a physician. I am an ophthalmologist and an eye surgeon, and have been for the last 45 years or so. And in my group of aviation friends, I have a large network of aviation buddies. They decided that I should become an aviation medical examiner. So in doing that, I said that would probably be a good idea. Why not? It's something I always thought of doing. And for a physician to become an aviation medical examiner, you have to be designated by the FAA. They have to show that there is a need for an examiner in that particular area.
Much like the DPE.
It's the same designation system as a designated pilot examiner. The FAA doesn't have nearly the personnel to do all of the medical evaluations as well as the pilot evaluations that they do, and therefore they need the designees. It's exactly the same thing. So in order to convert from being just a plain old physician to be an aviation medical examiner, you have to be designated, you have to pass a written test, which follows going out to Oklahoma City to Certification Central. And at Certification Central, you take a week's worth of extra training. I was very, very lucky because half of the training has to do with vision and eye stuff and whatever.
Right down your alley.
Right down my alley, but I had to refresh myself as far as cardiology is concerned, neurology, and all the other subjects. Pass another written test, come back, and then be designated officially as a junior aviation medical examiner. Most people spend years being a junior aviation medical examiner, gain experience, and then become a senior aviation medical examiner. Only the senior aviation medical examiners can do first-class medical exams.
But did not know that.
I was thrilled to do it. I was happy to be shamed into doing it by my pilot friends. I got the original designation here in Cartersville, and then I had my ophthalmology office in Atlanta and got a second geographical designation.
So Dr. Kozarsky, are you a pilot yourself?
I am.
What is your pilot experience?
I've been a pilot since there were dinosaurs on the earth. I wanted to be a professional pilot or a military pilot back in the 1970s. I think I soloed in 1973, but I needed glasses or contact lenses to see well, so that was sort of the end of the line back then as far as being a professional pilot. And I chose medicine instead, but during the time since I soloed in 1973, I've sort of gathered a lot of ratings and a lot of flying times.
What kind of plane did you solo back in 73?
In 1973, I soloed in a Cherokee 140 and worked my way all the way from the Cherokee 140 to a Mitsubishi MU2. And there were helicopters in there. I always wanted to hover, learn how to hover a helicopter.
So do you have helicopter time?
I have helicopter time. I'm a pretty good fixed wing pilot. I'm a very, very low time helicopter pilot, but fixed wing is great, hardwired for that. But I love the occasional times that my buddies will allow me to fly around in a helicopter as well.
The only time I flew in a helicopter, I was unconscious.
Oh, that's not
I got live flighted, but obviously it was a good flight.
Helicopters, as opposed to fixed wing airplanes want to fly, helicopters want to crash. It's a totally different thing. But
I've heard helicopters don't actually fly. They're just so ugly the earth repels them.
That's part of it. But it's there are two things. Learning to land a fixed wing aircraft which is a great accomplishment. Learning to hover in a helicopter is one of those things that sort of all comes together at once.
Yeah.
And you figure it out, and you wonder why you couldn't do it the day before, but you can do it today.
Yep, kind of like that round out and flare.
Exactly. And as soon as you figure out and say, why couldn't I do this before?
Right.
It's almost like a one-step learning kind of deal.
Yeah. So let's get into some of the stuff. I know people often have questions, or they're anxious about a medical exam. What information or advice do you have in terms of preparing for the medical?
Well, I think you're giving very good advice to your students that before you get, too deep into all of this and, spin your wheels too much and spend too much money, it's important to find out whether you qualify for an FAA medical. Okay, are there any deal breakers or factors that might delay your medical certification a lot? So, yes, preparing for your aviation medical exam, do you have medical conditions that you're treated for? Are you taking medications on a regular basis that could be disqualifying? And if they're disqualifying, are they temporarily and reversibly disqualifying, or are they just absolute deal breakers? And
so maybe can we get into that a little bit about like what is disqualifying? And people have these questions and they don't really know.
The conditions that can be irreversibly disqualifying are ones that you might come to logically. If you have a seizure disorder,
right?
Okay, that's going to be something where you're not going to be wanting to operate an aircraft. If you have very severe mental health challenges, all right, in terms of psychosis or difficulty controlling your actions, that's going to be something where there are going to be big questions whether you should operate an aircraft. So there are big ones like that.
Yeah, that makes sense.
Luckily, most medical issues can be accommodated into medical certification. Most medications can be accommodated into medical certification, but you really need to find out where you are in terms of all of this before you become fully invested in your training.
So you wouldn't want to wait until the day before your solo to try to set up your medical appointment, and then you're thousands of dollars in and you find out, so yeah, that's great advice. Maybe start that early on in your training.
Absolutely. And you're not going to be able to solo until you have a medical certificate.
Right. Got something to add, Emma? She's just hooked on the ball.
Yeah. That's called ball addiction. We'll talk about addiction later, but this is ball addiction, which does not contraindicate your being a pilot.
So I know one of the things that I personally use when I'm assessing myself before a flight is the FAA I'm Safe checklist. Illness, medication, emotional situation, and so on. What advice would you have, or what do you use to self-assess before every flight?
Well, that is a great checklist to use, and every student pilot and pilot should at least incorporate that into their thinking. But there's a very important federal aviation regulation, 61.53, and 61-53 requires a pilot who holds a medical certificate to self-assess themselves medically, emotionally, as far as are they prepared, are they suitable, are they safe to fly an aircraft that day. And that's at least as important as whether there's a medical certificate in your wallet.
No doubt. You can't be with them all the time, so that's why we as pilots have to also learn to self-assess and use a lot of it is common sense as well.
It's common sense, and everybody has their A days and their B days.
Yes.
And if you're going to try to do the most challenging flight you've ever done, and you know that you're in a B day, and you still have the symptoms of a terrible cold, your sinuses aren't right, you're tired,
It's like stacking against you, that
again,
risk management.
those factors, and you'll need every one of your faculties in order to do this well and to do it safely. You don't really want, in your words, you don't want to leave and embark on a flight when the deck is stacked against you.
Great advice. I know that nowadays it's a very common occurrence to have people on like ADHD medication or anxiety meds, and those can be disqualifying as well. Do you have any advice there in terms of what they should do if they've taken one of such medications or are on it currently?
If you're taking any medications, of course, look them up, okay? One of my little advice, everything that the FAA thinks and does, it's in their playbook, and their playbook is on their website. And if you can type into Google or your search engine, AME, next word guide, and you fill in the next word as to what that is. And if you want to put in antidepressant medications, ADHD, you can read the FAA playbook. But going back to your question, the important thing is, and I see this in young student pilots all the time, sometimes it seems like half of our population of young people are on ADHD medications.
Yeah. I have a lot of young students at the school, and it's very common.
It's very common. They most likely don't have a level of ADHD, attention deficit hypersensitivity disorder. They don't have a level that would disqualify them from flying, but they are taking the medication, and ADHD medications are absolutely disqualifying for flying. So this is commonplace. These young people have to be told, if flying is that important and you don't feel that you're totally academically or lifestyle dependent on these medications, talk to your caregivers, whoever is prescribing these, and ask whether it would be appropriate for you to try to be off of these medications.
Right.
And they will likely say yes, and then you'll go through the prescribed number of months that you need to be off of these medications, and then have testing, and to have neurocognitive testing by a specialized psychologist. And these tests will tell the FAA that your level of attention deficit, and all young people, especially young males like you and me, are all attention deficit to some degree.
Right.
All right. But this proves that it's not a level that, you're going to be looking at every gauge and thing in the airplane and unable to focus on anything. To forget where you're going and pay attention. And once that's proven that it's a minimal level of ADHD, or that you took these medications such a long time ago that there's a faster pathway to certification. But I go through this with young pilots several times a week, okay? And it usually has a happy ending. ADHD medications are performance-enhancing medications. They are, and that's the reason why most young people take them. It gives you cognitive maturity before you're cognitively mature, makes you do better in school. It's the ultimate trip to Starbucks, but as young pilots, they have to live without it.
Yeah. And we're so quick in today's society, if anything's wrong, a lot of doctors just medicate. So if you're training to be a pilot or thinking of being a pilot, maybe look into alternative medicine. If you don't absolutely have to have it, you're saying that might
look
be
at
the best
alternative
route.
measures, but make sure the alternative measures are not disqualifying as well.
Right.
Okay. You don't want to take 3 million milligrams of caffeine a day and make you feel totally wired. The other issue that comes up is the one that you mentioned, is being on other mental health medications. the SSRI, anti-anxiety, anti-depression medications. Many young people, many student pilots will come in and they're taking that medication. Well, that's also a long discussion that you'll have with these young, or older student pilots, and say, why are you taking the medication? Is it really important to you? And there is a pathway in which you can stay on the medication as long as it's one of the 6 SSRI, anti-anxiety, anti-depression medications that are out there. But the warning that I have to give is that there is a pathway, but it is a very long pathway.
Takes a lot of time.
Takes a lot of time. You stay on the medications. You have to be on a stable dose of the medication for 6 months. And then you are seen by a specialized psychiatrist. You are seen by a neuropsychologist. We talk to the people that prescribe the medication, et cetera, et cetera. And in doing all of that, we have a package of material that we send to the FAA. The FAA is so backlogged on doing and looking at these packages. It often takes a year from the time they get a package until they get to that file. And it is so frustrating for these young people that want to start aviation that it can delay things for a year.
I've seen in a lot of cases something like that happen, and then that year time period is enough to just make them throw in the towel right off the rip, But that brings us back to the point you talked about earlier. Get into this early and see, is there anything that might disqualify you? You have to get additional testing over.
And you can, I've had young aspiring pilots. I keep on saying young, they're not all young. We have student pilots of all ages, but we have aspiring pilots that can take flight instruction. As long as you're not going to solo and operate the aircraft by yourself, you don't need a medical certificate, but you have to ask yourself a question: how much flight instruction do you want to take before knowing
you'll pass it,
that you can pass? And that's a tough decision that needs to be needs to be discussed.
And on that same note, I recommend to my students, if they're young pilots, or like you said, they don't have to be young necessarily, but if they're going into a career of aviation, even though we only need a 3rd class medical for a private pilot's license, I encourage them to get a 1st class just to make sure they can pass everything, like you said. Do you think that's a good thing to do?
I think so. Unless a young person, a student pilot, is willing to say, I'm only going to do this for fun, I'm never going to do this as a profession, then they can get a 3rd class. That is not typical. Young people want to know if they're going to start flying, could I do this as a profession?
Yeah, that's what I said. The first time I did it, I was like, this is expensive. I got to learn how to make money doing it.
Exactly.
Because I want to do it more than once a week.
Or this is so cool, could I ever make a profession out of it? And if you're thinking that, and everyone does, why don't you make sure that you can hold a professional level flight medical certificate, and that's a 1st class. And what's not known is, do I sign up for a 1st class or a 2nd class or whatever? The vast majority of people that we're talking about are under 35 years old. And what a lot of people don't know, even in FAA, is that a 1st class and a 2nd class medical certificate under the age of 35 are exactly the same.
And then I learned this year, over the age of 35, you have to do an EKG.
Correct. And that's the difference. If you want a 1st class over the age of 35, you have to do an electrocardiogram. But what I will do, and a lot of the student pilots, not yours, but a lot of student pilots are not informed, and they come in wanting the 3rd, and they have the 20/20 vision that qualifies for a 1st, and the muscle balance that we test, the eye muscle balance that qualifies for a 1st. They come in for a 3rd, but I'll give them a 1st class. And I say, this is what you wanted in the first place.
I think you actually did that to me years back. I've been coming to you for quite a while, 2017, and then we just did a recent one. But yeah. What else? Is there anything you can think to add? Or
let's do this. Whenever I see a young student pilot come in, all right, that wants their first medical certificate, these are the things that I just say, oh, crap. Okay, these are
Listen
the things.
up.
Okay, these are the things that I say. This is going to make it. I say to myself, this is going to make it harder. And the first, second, and third one is ADHD medication. It's an obstacle we'll get past. The second thing are your anti-anxiety medications, all right, your SSRI medications, or worse yet, if you're taking more serious psychiatric mental health medications, it's a bigger problem to solve. The third thing, unexpectedly, are the young males that come in. And in the young males, 1 out of 10 of them is going to be color deficient. Okay?
colorblind?
They're going to be, we don't like to say colorblind because even colorblind is not a black and white world.
Okay.
But when we show them the special test of seeing the embedded numbers in the pictures and whatever, we'll find out that they are deficient visually, just as far as color is concerned. Thank goodness the vast majority we can find an easier test for them to take to pass the color vision screening, or if we can't, they can't pass our easiest test. These, and they're almost always young males. Females are protected by their genetics and they don't tend to be color deficient at all. But these young males, we will sometimes have to send them to the airport for a medical flight test, what we call an operational color vision test, where we ask them to identify the color light signals from a tower, to identify the highlighted colors on a sectional map. If they're going to be professional pilots, they get a night flight so they can tell, see if we can determine whether they can tell blue taxiway lights from white runway lights.
Pretty important.
It's pretty important. And again, I would say 90% of the time, we'll find a way to qualify them with their limited color vision. But that other 10% that can't pass anything, that is a roadblock to becoming a professional pilot. Yes, you can be a third class. You can have the restriction that comes with a severe color vision deficiency of not being able to fly at night or color light signal control. But a lot of people will have second thoughts about becoming pilots if they know that they can never fly at night.
Right.
That's a very small minority of color deficient males.
It's kind of one of those things I've heard people say, well, my vision's not this. It's not that it automatically disqualifies you. You may be able to continue on. It's where there's a will, there's a way in most cases.
But there's a color deficiency and we have to find the solution for it. But do you really want to go and invest $10,000 into if you know that there's a roadblock towards being a professional pilot?
Right. Great advice.
A simpler thing that would really help me as an aviation medical examiner, when you're coming in as a new student pilot and you know you're going to be wanting a first-class medical certificate, you're held to a 20/20 vision standard in each eye. For goodness sake, don't come in your old glasses that may not correct your vision, because I can't give you that first-class medical certificate unless you show me 20/20 vision in each eye. And that's a good thing that you can rehearse. There are computer tests that you can take. Go to your eye doctor, but don't be the one to throw the wrench in the gears yourself walking in expecting a medical certificate if you're not sure you're at optimal vision with your glasses or contact lenses.
And the vision test, just so we're clear, it can be done with corrective lenses.
Absolutely. The FAA, and for that matter, the airlines and even the military have become enlightened in the 50 years since I was a student pilot, that they will accept corrected vision, glasses, contact lenses, or laser vision correction surgery, LASIK.
That's a misconception. I think a lot of people think you have to have 20/20 vision for the first class without corrective lenses, but you can actually use your glasses. So
the military will generally look for pilots with 20/20 uncorrected vision.
Right.
Occasionally will waiver glasses or contacts, particularly Army and helicopter, but they do accept laser vision, LASIK corrected vision, which is pretty amazing because there are a whole group that can qualify for military aviation that couldn't even think about it 30 years ago.
That's great. Another thing, so I know it's required if you have a DUI, you report that. How would that affect your getting a medical?
Well, if a young person who just got their private pilot's license comes in and they're celebrating, or they're coming in for their next medical, or they just got hired for their first professional flying job, and they say, Dr. Kozarsky, how can I mess this up? This is such a good thing. How can I possibly mess this up? And I say, don't drink excessively. You know, if you're going to drink, if you're going to use alcohol, whatever, do it under control. Never, ever get a DUI. Never get a DUI. It's going to make your aviation medical life complicated. All right? And complicated can come from you barely got a DUI and you're going to have to go through an exoneration process for that. That's going to take time, gather records, and convince the FAA that this was just a one-time low breathalyzer level that won't happen again, and write a personal statement of how stupid I was and how I'm never going to do that again. But if you get a high breathalyzer result, it's going to be presumed that you do have an abuse or dependence issue with alcohol. And that is going to buy you a long wait before you get a special issuance medical certificate. And you are going to be, your abstinence is going to be followed for 7 years with random testing and in a very, very restrictive, very expensive program to allow you to fly. And the first, second, and third piece of advice is don't do it. You know, Uber.
That easy.
Yeah, I mean, don't do it. If you think you have a problem with alcohol, basically raise your hand, get it fixed. It's, you know, do that rather than to be caught by the FAA. And in every time you go for an aviation medical exam, it says, if you read the small print, the FAA is going to cross its database with that of all of the alcohol infraction databases of all the states in the United States, and you're going to get caught. Yeah. And the only thing worse than getting a DUI is the FAA finding out about your DUI.
Not being forefront with it.
Yeah, you got to come up front. It's always better to raise your hand. It's always better to be the one to tell the FAA than FAA to find out about it themselves.
Right. So you mentioned about the FAA takes into consideration like what the breathalyzer actually was on the DUI case, if it was a low amount or a high amount, which could indicate serious problems. I heard a horror story once about a doctor actually who came in late night. He performed a surgery, and as he was leaving, he showered, used mouthwash. He was pulled over by a brand new DUI task force cop, and he got a DUI for mouthwash. He beat the case, but some attorneys will advise not to blow. You know, you can beat the charge, but you can't beat the ride, or however that goes. They're going to take you to jail. But how could refusal affect the FAA's
The
standpoint?
question about refusal is a great question, and I really appreciate your bringing that up. And I hope everyone who is involved in flying hears this. There may be some protection against civil penalties by doing a referral. My DUI attorney friends tell me there aren't. You know, a refusal doesn't really buy you anything or any protection of your driver's license, because oftentimes the assumption, if someone goes through a refusal, is they're just trying to protect discovering a high alcohol level. The FAA will absolutely assume that a refusal was a high alcohol level. You make your situation worse with the FAA with a refusal, and no pilot should ever contemplate a refusal at a DUI type traffic stop.
That's great stuff. I'm glad we can talk about it here, and hopefully the best way to get out of that situation is don't get into the situation.
Well, let me amplify that a little bit. If you have a reasonably low breathalyzer, evaluation, the level is 0.08. 0.08 is a DUI level in all states. Well, if it's a one-time deal and you're between 0.08 and lower than 0.15, and all of the factors line up that this was a one-time piece of stupidity in an individual's life, and there's no other indication of alcohol abuse and dependence, the aviation medical examiner, me, can still issue a medical certificate. If you come in and it's a refusal, it's automatically deferred, and the FAA is going to do the full investigation, and a refusal will almost always result in a big delay and then a special issuance. And people don't know that.
No, that's...
Refusal is probably a terrible idea to avoid civil penalties. Mm-hmm. It is a horrendous decision for a pilot.
Great advice. Glad we could talk about that in here. So I know with your many years of experience, you have to have a wild story for us.
A crazy story as far as the medical is concerned. You and I are so, we are the rule followers, okay? We are the rule followers. I've been places, I've lived places where a careful search, you can search the FAA databases of who has pilot licenses, who have medical certificates. And I think in the pilot population in our particular geographical area, half of the people flying didn't even have medical certificates. Okay, that's a little bit crazy. Okay, do I really need a medical certificate to fly? Do I really need to wear vision correction if I really need to fly? And the answer is, it's a crack that's an inch wide and a mile deep, that you really don't want to do anything that's going to eliminate all forms of insurance. Yeah. You don't want to pay for whatever damages you do
100%
out of your pocket.
I know that if a lot of people don't think that, but if there's ever a situation that adjuster,
right,
that's one of the first things he asked for is the pilot's information logbook to prove they were current and that they had a valid medical. And if they didn't have a valid medical for some reason, you can forget insurance.
Yeah, you can forget that. You don't want to go there. It's never ever worth it. But there have to be crazy. Let's see. I know there are crazy stories. What are crazy things?
Well, this may not be a crazy story, but we can circle back. But did you ever hear of the girl that got her pilot's license with no arms? And it was in, was it Flight Training Magazine or AOPA, through a soda? That's something that I guess we didn't talk about, a statement of demonstrated ability. So if there's something like that, she literally had no arms and she flew with her legs.
There is within the FAA, both medically and as far as flight standards are concerned, there is an incredible amount of flexibility. Okay, there is an incredible, and that you can have medical impairments, permanent medical impairments that you can overcome, and the FAA will let you prove in a medical flight test that you can operate an aircraft safely. All right, and it's amazing. You know, from one standpoint, a pilot with one eye. If you lose an eye for some reason, or you only have vision in one eye, the FAA will allow you to take a medical flight test and give you a waiver, a statement of demonstrated ability, to say that you can operate an aircraft with one eye. You know, you can operate an aircraft with cochlear implants if you were born congenitally deaf. There are all sorts of accommodations that can and will be approved by the FAA for your imperfections medically.
The human body is a resilient thing.
And highly motivated people can accomplish amazing things.
Yes, that's a great point.
But I do have crazy stuff. I'm just not connecting on a crazy people that show up. You don't really want to get into the mental health.
I know some
part.
of them probably, or you see them coming and you're like, oh, not him again.
Yeah. You know, you definitely have people walking in, and I used to be bipolar when I was younger, but I'm not bipolar anymore. And if you take a look at it, there are 14, I believe, absolute 14 medical reasons for people that can't have a medical certificate. And sometimes you just hate to see that absolute dead end.
Yeah.
You know, you hate to see that absolute dead end. Don't try to hide stuff. Don't try to hide medical issues from the FAA. All of those conditions they ask for is, have you ever in your life? Okay? Medical visits are the previous 3 years, but those questions are, have you ever in your life? And that is, you have to know that when you answer those questions, and know that it's an application that was transmitted, that is being transmitted over state lines, and it's a government document. So it's that level of complete, truthful seriousness that should go into your answers. And again, have you ever in your life, on the conditions, all of your medical visits for the past 3 years, and whatever medications that you are on, and know that FAA is not beyond asking for your pharmacy records. They're pretty smart, they're pretty sleuthy, and sometimes they don't even have to try hard to find out there's an issue. You know, I have a pilot that 2 years ago just came in with a totally innocent application. Everything was fine, got a medical certificate, and there always is going to be someone who's either going to get angry at you, or for some other reason use the FAA's hotline to disclose something that you probably wouldn't want to disclose. In this case, that you were a serious alcohol abuser, that you had been hospitalized for your alcoholism, that you had had all of these major issues with alcohol dependence. And of course, whether this is an ex-girlfriend or an angry wife or whatever the case may be, the FAA is required to follow up on every hotline request. So there is really no safe place to hide your medical secrets, and particularly if those medical secrets would be something of significance as far as aviation safety is concerned, there are a lot of reasons to raise your hand and disclose, because that's part of safety.
Right.
Always consider that in a relationship breakup, if someone wants to throw a very various dart at their former lover, it will often be via the FAA's hotline.
Yep.
And FAA cannot ignore any hotline complaint.
Well, Dr. Kozarsky, I want to thank you again for your time today. This has been some great advice you've given us all. Hopefully we've helped you all with some information that you were wondering, but we got it straight from the horse's mouth today. Once again, thank you very much.
Thanks for asking all those great questions.
Yes, sir. I forgot to introduce Emma.
This is Emma, the AME dog.
Emma, the AME dog. Should we do another intro like with Emma, you think? Especially, see, she barked and then she'd be in the video.